Could mindfulness change the lives of people in prison? What about an anxious college student or a patient with bipolar disorder? Or how about people struggling with cancer? We know the research. Now let's look at mindfulness in real life, specifically with some of the challenging issues that patients bring us. We recently asked how you use mindfulness in your work, and we heard stories from hundreds of you. So we chose 4 of them, short, inspiring stories from practitioners like you who are using mindfulness to create real change. Each story shows a different practice and a different population, but together they all testify to the power of mindfulness to transform lives.
I work with a young woman who has bipolar disorder. She's a rapid cycler, and she's had a hard time coping with her life because of her bipolar. So when she first came to me, her life was very unmanageable. She just had a hard time getting up and being in the world. But when I introduced mindfulness to her, she responded with, "It's just too hard and one more thing to do." I kept talking about mindfulness, bringing her back to it, and little by little she started using it. She is responding rather than reacting to what happens to her. She's very mindful of what she's doing and what is coming up at the time, and she's really using mindfulness to help her cope with her life and make it work. She's working and she's a student, and so she's doing all kinds of things that before she didn't feel like she could do.
I'm a mental health specialist. I work with a county jail setting in northern Chicago. At this point, I'm working with women, and I teach them mindfulness meditation. Many of our inmates have histories of trauma and neglect in their lives that they have not faced yet. And for many of them, this is the first time of beginning to talk about some of the things they've been through and to begin the process of resolution. They're in crisis. They are really, for many of them, they are ready for change, and they're ready to learn something new. I teach them mindfulness as a way of addressing the dissociation that many of them have been experiencing through running from their neglect and abuse histories and getting into addictive patterns with substance abuse primarily. A lot of heroin, cocaine abuse, a lot of other types of self-abuse as well. And the mindfulness is introduced as a way of introducing them to self-care, essentially, and hopefully caring more about other people in their lives. I usually start with a minute, and for many of them, there are about 40 women on the tier, and it's quite an experience for them to have a minute or longer of silence. And that in itself is a powerful thing for them. But after only a minute, many of them, usually at least a quarter of them, will say, "I feel a great sense of peace, a sense of that this is very helpful." And over a period of time, period of several sessions, they will say that they reduce the amount of times that they snap out at people, that they're impulsively reacting to people. We've dovetailed this technique in teaching about boundaries, healthy boundaries, and self-care in general. And they are able to kind of create a haven of peace for themselves, essentially. For many of them, they also experience what I've encouraged them to be aware, try to be aware of, is a sense of growing compassion. Compassion for themselves and compassion for others in their lives.
I had a young woman come to me, and she was experiencing a lot of anxiety. What I did with her is I asked her, I said, "Why don't we meditate together, and we'll do that in the session." So we would take a few minutes or so and within each session and just spend some time meditating. That seemed to be very helpful. She looked forward to coming in and practicing mindfulness. And then slowly I gave her homework assignments to practice mindfulness at different times during her day. She said that that was the single most effective thing to help her calm down, to help her center herself. Today, she experiences no anxiety. Her business is very successful. As what she said, I feel like I'm getting my true self back again.
Okay, the program is called A Time to Heal, and it's a 12-week holistic rehabilitation program for people who have been through cancer treatment. The people that come to us usually have just finished their cancer treatment. They're usually very frightened and confused. The whole program is focused on choice, having people be able to really look inside and make some conscious choices about what they're doing with their life. And that's harder than it sounds because your mind gets so wrapped up in fear that sometimes you're really sleepwalking through life instead of really being aware and understanding the ways to make the most of the life that you have. So, for instance, with all of the programming that we do, we try to first of all look at mindfulness cognitively, like what's your intention? What are you thinking? What are the thoughts that are running through your mind? We talk about resilience and what are your unique characteristics that you can use to build yourself back up and to triumph over this. We talk about fear and how do you recognize when you're operating out of fear or out of defensiveness and not really making choices. And then after we have them sort of cognitively interested in that, every night we teach them a specific power tool. And those are all things that practical applications that they can do right in the moment.
And let me just stop you for a second. You called them what?
Power tools.
Power tools. So you don't call them meditation or mindfulness techniques, you call them power tools.
We do. When you are dealing with cancer, one of the prime feelings you have is powerlessness. You know, you have an invisible invader in your body. Doctors are making decisions. You can't see the medicine working, and you feel very powerless. And so we want to give them their power back. And one way to do that is to take charge of your mind and be conscious in your behaviors as well. So one of the things that we teach is breath counting. And we've had people come to us and say that they have not had a decent night's sleep, even with all their pills, since they had cancer maybe several years ago. And after they've practiced the breath counting, they'll come back and say, I didn't think that was going to work, but I'm sleeping through the night now. I've been able to just relax my mind. And that's a wonderful non-pharmaceutical intervention. And we found that the holistic program really results in people showing significant improvement on 5 different measures of quality of life, including happiness and hope, post-traumatic growth, depression and anxiety decrease, quality of life is good. And not only that, but 6 months after the program's over, they've maintained the gains. And I think that goes back to practicing these mindfulness tools.
We've just seen how mindfulness can change heartbreak into hope and despair into empowerment. These 4 stories show how effective mindfulness can be. And they were just some of the hundreds of stories you shared with us. We also talked with a special education teacher who used mindfulness with a child who had Asperger's syndrome, and a social worker who used mindfulness with a patient addicted to gambling. And the list goes on and on. Mindfulness works. This we know. But knowing that mindfulness works and integrating it into your practice are 2 different things. So we're working on a series that will help you turn your understanding of mindfulness into sophisticated yet practical applications for your clients. We're designing it to address your questions. Questions like, what's the best way to introduce mindfulness to patients? How do you get people to practice on their own outside of sessions? And how do you work with clients who are not open to the idea of mindfulness? Getting the answer to these questions is a key step in putting mindfulness to work in your practice. We'll also be looking at how mindfulness is especially effective in facing fear and uncertainty and in coping with feelings of unworthiness. We'll get into the building blocks of mindful attention and how mindfulness can help our patients confront their limiting beliefs. We'll also have a chance to talk with the originators of mindfulness-based cognitive therapy, as well as acceptance and commitment therapy. So be on the lookout for an email I'll send you in just a few days. But right now, please let us know your toughest questions about using mindfulness in your work. What hurdles do you face in making mindfulness work with your clients? What do you need in order to start implementing these life-changing practices right away? Please let us know on the comment board right below this video. And thanks for watching.